Thank you and welcome to the show this morning. The topic this morning is kidney disease and hypertension. And we're fortunate to have with us two persons to talk about kidney disease and hypertension. Dr. MFaulkner, professor of internal medicine at Meharry Medical College. And of course with Dr. Faulkner is Ms. Phillips, who is the coordinator for the AASK program. And of course, Ms. Phillips will give us some information about the AASK program, as will Dr. Faulkner give us some information about hypertension and kidney disease. Let me welcome both of you, Dr. Faulkner and Ms. Phillips, to the show this morning.
Thank you very much.
Dr. Faulkner, what we'd like to do today is to talk about our topic, kidney disease and hypertension, especially the impact that both of these diseases have among African Americans. But before we get into that, let's have you and Ms. Phillips to give us some information about your background, your education, and some of the things that were important in terms of your careers and leading you to where you are. You, Dr. Faulkner, as a person involved in internal medicine at Meharry Medical College.
Well, first of all, I became interested in kidney diseases when I did my residency at Meharry Medical College. I am a graduate of Meharry Medical College in 1981, and I did my residency there. And during my training, I got interested in kidney disease because we had a lot of patients coming into the hospital with kidney disease and going on to dialysis. And after I did my residency training, I went into public health in Mississippi. Again, we had lots of patients with hypertension and kidney disease. And afterwards, I thought maybe I should do a fellowship in internal medicine, in nephrology at Long Island Jewish Medical Center in New York.
Very good. Ms. Phillips, let's look at your background and some information that you have in terms of what led you eventually to the coordinator of the AASK program with Meharry and Vanderbilt University.
Okay, I am a registered nurse. I graduated from Tennessee State University in 1975. I was involved with various areas of nursing and internal medicine on the floors and so forth. And in 1985, I got the opportunity to become involved in clinical research. I have been a clinical research nurse since that time. I became aware of the AASK program on its inception when the pilot study was started and was involved in the early phases of development of that project. And it was always so very intriguing to me. One thing is that as a person who's been in research for that many years, it is the best program that I've seen for African Americans since I've been in clinical research. And that just makes me so enthusiastic about it. And on a personal note, I had a grandmother who had hypertension and ultimately died of a stroke. So that enhanced my, interest in AASK.
Very good. You know, Dr. Faulkner, when we talk about kidney disease and hypertension and all of these other diseases, a lot of folks might not have a clear definition of what it means to have kidney disease and what hypertension is. So why don't you give us some information, some medical information about what constitutes kidney disease and some of the causes, as well as some of the causes of hypertension and some of its effects.
Okay. Well, kidney disease actually means that you have some damage to your kidneys. You have two kidneys, and in order for us to pick it up in your bloodstream, you have to have damage to both kidneys. When that damage occurs, you retain certain things that we monitor in the blood. When you start to retain those things, like blood urea nitrogen, and what we call creatinine, was a muscle breakdown. It's a protein in which is broken down by the muscle, and that protein builds up into the bloodstream. We monitor that protein when you come to the doctor's office just to have routine blood checks and so forth. When that portion of your blood is elevated, that creatinine is elevated, we know then that you have some kidney damage. And your kidney damage can range from being very mild to being very extreme. When it's extreme, that means you go on to dialysis.
And so there's a possibility, simply because the person has kidney problems, quote unquote, it does not necessarily mean that it's a very, very critical, well, of course it is critical to have a problem at all, but there are degrees of critical in terms of the kidneys. Is that what we're saying?
There's mild, there's moderate, and there's severe.
Very good.
And then there's end-stage renal disease.
Now, what's the difference between those now?
Well, in very mild disease, that means that you function just like you normally do. We may watch your protein intake. We may watch your diet. When there's moderate disease, we have to watch other things. We have to watch your salt intake. We have to watch how much water you take in. We have to watch your potassium. When there's really severe kidney disease, then that's when we start to prepare you for dialysis and so forth, because we know that very soon you will not be able to handle your potassium intake, your fluids, you may get short of breath, you may get swelling in your lower legs and so forth.
Well, now, what are some of the signs that a person who might not have had an opportunity to take a battery of tests, but at the same time might be alert to the fact that he or she might have some kidney damage, even though it might be ever so mild? What are some of the signs that they should look for personally?
Well, the signs are not there clinically. You can't really tell when you have kidney disease, and that's the problem with kidney disease. It is a silent disease. The kidneys, you can't hear them, you can't feel them, you can't see them, and the doctors can't hear them, feel them, or see them. So the only way we can tell is when we really draw your blood, and sometimes when we look at your urine, we can tell. Only late, when you have late kidney disease, that we can tell that there is something going on. You can tell by shortness of breath, you can tell by swelling of your legs, but that's very late. Even later than that, you don't eat very well, so you start to lose weight, and you start to become anorexic. And that's when you can tell. You may have some nausea and vomiting and so forth. You may get severely anemic and feel very weak. Those things you can tell, but by that time it's very late and much too late to do
And so there's no real preventive kind of thing that you could detect very early that you've got. Is this a disease of progression or what? Is that what we're saying?
This disease is very progressive. There is early detection. The first thing you can do is get your urine checked. That is used as a screening test for many people. It's very inexpensive, and many doctors' offices, just about every doctor's office, would dipstick your urine. The other way is to check your blood. They can check your creatinine in your blood urea nitrogen. Those tests have been around for many, many years, and they're very inexpensive. And that's the way that we can sort of monitor to see what preventive mechanisms we can do to keep you from having kidney disease. Now, you asked about
Hypertension.
Hypertension, yes. Hypertension is the #1 cause for blacks being on dialysis in the United States of America and in the state of Tennessee. In the state of Tennessee, there are approximately 4,000 people on dialysis. I'm sorry, there are approximately 3,000 people on dialysis.
In the state of Tennessee?
In the state of Tennessee, 3,000 people on dialysis approximately. And over half of those, I'm sorry, just under half of those people are African American. So about 48% of the people on dialysis in the state of Tennessee are African American. Now that's surprising because we're only 15% of the state. Not only that, the #1 cause that we're on dialysis for is hypertension. The #2 cause is diabetes mellitus.
Well, now what causes hypertension?
Well, we don't really know what causes hypertension. We suspect that there's a defect in the kidney. We suspect that the kidney retains salt abnormally, and that salt that's retained builds up in the blood vessels, and that causes the blood pressure to go high.
Very good. Ms. Phillips, you know, we were talking about some of the causes of these diseases before we got to the AASK program between Meharry Medical College and Vanderbilt University. Let's have you to talk about that program, and of course we might interrupt you with a commercial break here, but let's start off by talking about the AASK program. First of all, during this minute before the commercial break, give us a definition of that program.
First of all, AASK stands for African American Study of Kidney Disease and Hypertension. It is a program that's funded by the National Institutes of Health. There are 20 centers in the United States that are cooperating with this study, 2 of which are Vanderbilt University and Meharry Medical College collaboratively. And we've started into the full phase trial of the AASK study as of last May of 1995. So we're now in the first year of our recruitment, entering into our second year of recruitment.
And so you're trying to bring more people into the program to be tested, and so that you might be able to assist them.
Definitely. We're looking for African Americans between the age of 18 and 70. And one of the first things that we would do is one of the tests that Dr. Faulkner alluded to, that is the serum creatinine, because we tell people that even though you may have made doctor's visits.
Okay. Well, let us interrupt you here, and we'll be back with you following this commercial break.